This is Dr. David Kulak. We are here at Pinnacle Radiology, which is in our building at 6010 Bay Parkway, and we're going to go take a look now to see what exactly happens during an HSG, a Hysterosalpingogram. We're going to give you guys a little bit of a tour because everybody's really anxious about it, and most of our patients leave and saying, "That's it? It's all over? I was scared for nothing." So I want to give you a little bit of a tour, let you know what we do during an HSG, let you know that you don't need to worry, and maybe if you know a little bit more, you'll feel a little bit more comfortable coming in. So here we go. So we are going to start by walking into this door that looks really scary, and we're going to go into our procedure room, and we have some equipment to protect us from radiation, and we have our screens so that we can see the pictures that we take during the procedure, but more importantly, we have all the things that we're going to use. So here we go. Here's our table of tools that we're going to be using. We have our speculum. It's what the doctor puts in so that he can see the cervix, or she can see the cervix. And then we have some fluid here to clean off the cervix. And we have these super long, cool Q-tips. And that's going to make sure that there's no infection. Then we have the tubing and all this sort of extra stuff just for cleaning. And then this teeny tiny, that inner line, that little blue catheter, that little tiny part is what's going to go inside of the uterus and allow us to put the fluid in. So it looks like there's a lot, it looks like it's scary, but really the only part that's going to go inside the body is that tiny little blue tip right there. And sometimes it causes a little bit of a cramp, but shouldn't be too uncomfortable. We don't have anything sharp here. We don't have anything that's going to make you bleed here. It's going to be just like a little bit of an intense pap smear. So once we use all of those instruments and we have everything inside and ready, we put some fluid inside through that little tubing, through that little blue tip. It goes into the uterus. We take some pictures. We can see the fluid, which is like a clear fluid. We see it come up really bright on X-ray. We watch it fill up the uterus. We watch it flow out through the tubes. The whole thing takes about 5 minutes, maybe some mild cramping like a period, and then our patients hop off the table. They have their results immediately. You know if your tubes are open, and we send the information to the patient's doctor if it's not the person that's doing the procedure, and that's the whole thing. It's really not that bad. A little bit of Motrin or ibuprofen before you get started can be really helpful to prevent any cramping, just like period cramps. The procedure is great. It tells us not only if the tubes are open or closed, but also tells us if there's anything inside the uterus that could prevent an embryo from implanting. And sometimes if the tubes are like mildly blocked, we think, the fluid that we put in can actually open them up, and patients spontaneously become pregnant the next month. We see that maybe about 1 to 2% of the time that patients just get pregnant spontaneously. After a year or 2 or 3 years of infertility, they do their HSG, and then the next month they come in pregnant. It's amazing, and we love that. So it's called a diagnostic, but sometimes also therapeutic. It treats patients sometimes. Not something to worry about too much. Make it a part of your workup if your doctor thinks that it should be, and don't be too worried about getting it done.